When I was looking into residency, there were a couple of things that I really wanted. But what I found out is that at the end of the day, what it really is the biggest factor is where you feel like you fit. They seemed interested in me as a person more than just a resident, and I felt like if I came here, I'd be a perfect fit. The culture's what I wanted, so I've been very happy with my decision.
We have a very personable team. Everybody knows each other. As you're walking through the hall, you can't get through the hall without saying hi to 5 or 10 people that you know. I think that makes a difference. We encourage our residents to really push out and advocate for pharmacy, which I think makes our program very unique and very collaborative with other programs to help us develop and grow.
The PGY1 pharmacy program has a number of different opportunities as far as rotations, including infectious diseases, medication safety, as well as some electives in cardiology. As far as training programs, outside of the first training programs, we have a number of PGY2 opportunities, such as critical care, solid organ transplant, infectious diseases, oncology.
One of the reasons I love working here is because you're going to see something new every day. Different patient cases that you haven't seen in years, and that's a unique opportunity you get from being at such a large institution and with such a diverse patient population.
Working with the attending physicians is great here. They are very welcoming. This is a very welcoming teaching environment. They welcome pharmacy services.
More and more they give you autonomy as they know that you know what you're doing, you get independence, but you always feel like you have a support system there that's really happy to answer questions, and that's a really nice mix as well. And having that support network was really something that A, helped me choose my path, and B, helped avoid burnout. I learn so much every day. They really prepare you for no matter what.
I always thought UH was very unique because on main campus, you get that main campus feel and you get that large academic medical center feel. But we also have all these community hospitals. You get to see how system committees work versus the committees that are just worried about main campus. An initiative might be great for the academic medical center, but once you start having to consider other people's dynamics in their smaller hospitals, from a 10-bed hospital all the way to a 200-bed hospital in our communities, you have to think about things differently. And I think our residents that do end up not taking a job here, leave with that perspective that a freestanding, not in a system academic medical center wouldn't provide.
As far as our motto, UH's motto of to heal, to teach, discover, are really a very simple phrase, but I think it really emphasizes on what we want to do. The friendly faces take care of really challenging patients, really see complex diseases, and work with really talented physicians, nurses, other pharmacists at the bedside, and trying to really optimize patient care are reasons I really enjoy coming to work at UH.
They care about you not as just a professional, but also as a person, and you feel valued in the work that you're doing every day.
I think that's what our residents continuously say about our preceptors, is just how much compassion they have, how much they want to help. We have mentorship programs in which they meet with the mentors, but there's a lot of informal mentors where it's just stopping by somebody's office to talk about your day or talk about a problem that you have, and everybody always makes time for that for the residents. You can't get through a day here without smiling or laughing or just feeling a little bit better by the end of it.
I feel like a lot of places on paper look very similar. And so they all say, we have this rotation, this rotation, this rotation. We have, research experience, all these different things. And so when it comes down to it, at the end of the day, what it really is the biggest factor is where you feel like you fit.
The point of residency is for learning, and residents that make the most out of that experience are usually the ones that are going to be the most successful.
We're looking for people that want that growth, that want to evolve where they are, but also people that are going to add to the culture. Those people that want to be a part of the university hospital's mission.
And I feel like I've gained such a strong foundation as a PGY1 that I'm super prepared, either if I want to go into a job next year or as I've decided to do a PGY2. So I've been very happy with my decision.